Hello, Mr.
Hey.
Johnson.
Hello there, Dr. Hurwitz.
Nice to see you again.
You too.
You remember Angela, our scribe?
Hi, Angela.
All right. Well, you brought in a log of your blood sugars and blood pressures. So
Yeah.
let's take a look at that.
Okay.
Thank you for being so organized. So these are AM and PM values.
Uh-huh.
And your blood sugars in the mornings have been roughly 60s to, seems like low hundreds. Of the first of the month it was 130. And then in the evenings they trend higher. Oh, and I see you had a value of 240 after you had some guests over.
Yeah,
Okay.
my diet wasn't the best.
Yeah. But they seem to trend, in the evenings they seem to trend 110s to 130s, 140s,
Yeah.
by and large. Couple of high values, 185 on the 8th, 210, 240, and 180 on the 17th, 18th, and 19th.
That's when the guests came over.
Yeah. And then blood pressures, let's see, you were doing it twice a week. Good.
Sundays and Wednesdays.
Sundays and Wednesdays, and we have
Yeah.
values of 120 over 80, 130 over 85, 126 over 82, 132 over 78, that was on the 14th, and then 118 over 74 on the 17th, but up to 140 over 90 on the 21st, and then back down to 122 over 76 on the 24th. Okay. So your blood pressures are trending a little bit higher than I would like to see in
Okay.
general. And we talked before about your kidney function,
Mm-hmm.
and it was going up a little bit.
Mm-hmm.
I think it's time we start you on a blood pressure medicine.
Oh, well.
And typically what I like to start with is lisinopril. It's
Okay.
a once-a-day medicine. You take it in the mornings. We're going to start you at 5 milligrams a day, and we'll see how your blood pressures do. We may
Okay.
have to increase that over time.
Okay.
Okay? And if they continue to creep up despite the lisinopril, then we'll add a second medicine as well.
Okay.
But the lisinopril is good because it acts as a kidney protecting medicine and also protects your heart from the bad effects of high blood pressure over time.
Any side effects to that?
Some people can get lightheaded
Oh, really?
simply because their blood pressure
Is low.
is going lower than they're accustomed to.
Okay.
And you'll notice that particularly if you're lying down and then stand up suddenly.
Mm.
That effect tends to go away over time as your body adapts to the new lower blood pressure.
Okay.
So let's give it a couple of weeks at least to see how your body reacts to it.
Okay.
So expect that.
Okay.
All right. Continue taking the metformin. Your blood sugars are in, I would say, a reasonable range. You're taking metformin 500 milligrams twice a day right now, correct?
Correct, yeah.
All right.
And then I did see the dietitian like you recommended, so
Excellent.
I think maybe the blood sugars are reflective of that, at least I hope so.
Yeah.
Yeah.
Good.
Yeah.
Let's continue to watch that. I don't want to make any changes just yet. Sometimes people do need to go up on their metformin, but we don't need to do that just yet.
Okay.
And how's your exercise?
I think I overdid it. I ran a little 10K race and I did some training, and my knee is really much more painful.
Oh no.
Yeah, and it isn't getting. I'm not recovering from it, so
Okay.
yeah.
What's the pain like?
It's just in the front inside of my knee, and it hurts when I walk, hurts when I go upstairs, downstairs mostly.
Okay.
Yeah.
Does it improve if you rest it?
Some.
What
Seems
else
like
have you been doing to treat
a little bit of
Anything
ice,
else?
a little bit of ice now and then, but nothing else really.
No pain medicines?
No.
Okay. All right. I want you to stay away from ibuprofen and the non-steroidals because of your kidney function. Okay.
Oh, really? Okay.
You can take Tylenol as needed
Okay.
over the counter, but stay away from the NSAIDs. So this pain, it sounds like it's worse with any kind of activity. It improves a little bit when you rest. Okay. Is it swollen?
Yes.
Is there any redness?
No, not really.
Okay. And do you hear any creaking or popping or crunching?
No.
All right. This pain, is it sharp, dull?
Sharp. Really sharp.
And it's constant? Or
It's
is it
achy. It's not. It's achy and constant, but the sharp pain is with activity.
Pain never goes away, but it gets worse with activity.
Correct.
Okay. All right. Well, let's take a look at it.
Okay.
So, Angela, eyes and mouth, neck, chest, abdomen are normal on visual exam. The left knee has some mild swelling. Does this hurt when I move it?
No.
Does it hurt when I press on the
Yes.
kneecap? So
Yes.
there's tenderness over the patella.
Yeah.
How about over the outside?
No.
So lateral aspect is non-tender. Medial aspect? All right,
Very
so the
tender.
inside is very tender, particularly over the MCL. The popliteal fossa is normal to palpation. Let's have you lie down on the bed if you would.
Okay.
Let me bend the knee. So Lockman's test is normal. Anterior and posterior drawer tests are normal. There's no crepitus, no subcutaneous masses. There's mild edema and it's mildly warm. Have a seat. Well, your knee seems to be getting worse. Let's send you to Dr. Febinger.
Okay.
He's probably going to want to get some x-rays and maybe an MRI scan.
Okay.
And it may be time to do something about your meniscus. Or maybe you need to see a physical therapist about your medial collateral ligament, which is the one that seems to be tender.
Okay.
Okay. So in the meantime, what we can do is I'll have the nurse come in and we'll apply an ACE wrap.
Okay.
And we'll give you the number for Dr. Febinger. You'll call and schedule an appointment for the next couple of weeks.
Okay.
All right. In the meantime, rest it, keep it elevated, keep the ACE wrap on it, and you can ice it 10-20 minutes a day or 4 or 5 times a day.
So no running?
I would say no running.
How about cycling?
Low impact exercises like cycling and swimming are probably okay, but watch it if your pain worsens with those activities. Cut it out.
Okay.
All right.
Thank you, doctor.
All right. It was nice to see you again, Mr.
You too.
Johnson.
Thank you.
Wait for the nurse to come by.
Okay.
And Angela, if you wouldn't mind printing his after visit summary, I'd be grateful.
Have a good day.
You too. Hi, this is Dr. Hurwitz to speak with Dr. Febinger, please. Dr. Febinger, hello. This is Dr. Hurwitz over at the Family Practice Clinic. Hi, look, so I have Warren Johnson in my clinic. He's a gentleman in his 50s who presents with left knee pain. He saw me about 6 weeks ago and was complaining of this mild medial left knee pain that in the intervening period has worsened. So he has a history of diabetes and we're controlling his blood sugars. He has a history of hypertension. We're managing that. I'm going to start him on some lisinopril today. He's otherwise pretty healthy guy. No prior surgeries on this knee, but he's noted some meniscal issues in the past. And on exam, he's got a stable knee, but very tender over the MCL on the left with some swelling and mild redness. I think you should take a look at him sometime in the next couple of days. In the meantime, I'm going to apply an ACE wrap. He's going to ice it a couple times a day and rest it. Yeah, he's been running. He ran a 10K last week, and things seem to have worsened after that. He does some cycling and swimming. All right, good. I'll have him give your office a call. Thanks a lot. Take care.